Thank you for staying with us on Channels Television. A very warm welcome to Health Matters. I am Yomi Otaigbe. A major non-communicable disease affecting both children and adults takes our attention on the program today. In 2023, according to the World Health Organization, asthma affected an estimated 363 million people and caused 442,000 deaths. We'll be separating asthma facts from fiction, highlighting its triggers and why it's important to properly manage the condition. I'll be right back with my guest after this quick break. Joining me now in the studio is Dr. Olurotimi Agbola, a consultant family physician and healthcare leader with over 9 years of clinical experience in family medicine, chronic disease management, emergency care, outpatient services, and primary surgical practice. Dr. Agbola also holds leadership responsibilities as head of the primary surgical unit and co-head of the chronic medical disorder clinic at the Lagos State University Teaching Hospital. Thank you indeed for joining us on the program, Dr. Agbola.
Thank you.
So many factors have been linked to increased risk of developing asthma, although it's often difficult to pinpoint a particular cause or a direct cause. So what are those predisposing factors for asthma?
All right, thank you. Asthma, like you have mentioned, it's a chronic disorder condition affecting the respiratory pathway, and it's a non-communicable disease. So predisposing factors to asthma, there are two major predisposing factors. You have the genetic factors and the environmental factors. So for the genetic factors, you now have, it could be familial. It could run in family. Some people have the genes that, makes it transmit to other people in that family. So a family history of asthma is important. Then some people too, they also have these allergic conditions that can predispose them to having asthma. Eczema, allergic conjunctivitis, rhinitis, and stuff like that. People that have that too could also have that. They could also have asthma. Then you have environmental factors like the allergens, house mice dust. House mite dust could be from either cockroach poo-poo, rats poo-poo, all those things could cause dusts, molds on the house, either from algae formations and stuff like that on the wall. Damp walls could also, those are house mite dusts. Then you have irritants like insecticides, strong perfumes, all those things could also trigger asthma. Smoke could trigger asthma. There are other conditions too that could trigger asthma, either exercises, strong emotions, stressful activities could also trigger asthma. Obesity too could trigger asthma. Due to blockage of the airway, this could also trigger asthma. For children, that's either due to their birth conditions, premature children, children that have low birth weights, those things could also affect their airway when they are coming out, either due to non-proper development of their airway. They are also predisposed to asthma. Viral infections too in the environment too, when such individuals have such kind of viral agents causing infections in them, could also predispose them to having asthma in future. So there are things that could lead to asthma.
It's really a cocktail of, predisposing factors that could affect, or can be appointed to one having asthma. The WHO has said that asthma is often underdiagnosed and undertreated, particularly in low and middle income countries.
Yes.
So how do you know? Because sometimes, yes, we've not talked about the symptoms. Sometimes you find, some of the symptoms of, this asthma, this condition present or pointing to something else.
Exactly.
So let's talk about the diagnosis for asthma.
So diagnosis, in making a diagnosis, first of all, you need to talk about symptoms, because it's the symptoms that will lead to diagnosis from the history. So history is very, very important in trying to get a diagnosis of asthma. As family physicians, I tell my residents that diagnosis is the main thing. If you have a misdiagnosis, then you don't know what you are treating, you know. So in making a diagnosis, symptoms, like I said, of cough, you know, first of all, predisposing factors, just like we have mentioned.
That is
Dust,
whether it's familial or it's in the environment.
Yes, okay. You know. Then you now talk of what are the symptoms that you expect. Cough, you know, the person is coughing frequently. Most times it also occurs at night, this cough. Maybe due to the weather, maybe due to the house, you know, that's when they are at home with house dust mites and stuff like that. Then wheeze, you know, due to there's narrowing of the airway. Normally, assuming the airway is supposed to be like, assuming it's 5 millimeters, you now have 1 millimeter due to inflammation, due to what you call edema. Edema is swelling around the airway, so it causes narrowing of the airway. That can now lead to what we call wheezing. You know, there's this sound that comes out from the person. You know, that's a wheezing sound. That's another way of making a diagnosis. Then shortness of breath. The person is having difficulty breathing. Obviously, somebody that is having that wheeze will have shortness of breath, difficulty breathing. And there's this tightness around the chest because it also involves the muscles of respiration. So there's tightness of the chest. So those are the things common things you expect from history. Then you now go to examination. If the person has come to meet a medical personnel, on chest examination, you hear what they call ronchi sounds. These are abnormal sounds in the chest, in the lungs. You know, this also gives that away. Then from there, you now do investigations. A chest x-ray to rule out other things that could be a cause of that. Then you do what we call spirometry. Spirometry also helps to make diagnosis. But at the same time, even from your history and examination, diagnosis most times is made. And from there, you can institute your treatments. By the time you start your treatments, you see when the patient is recovering or not. So most times, clinical diagnosis, majorly, you will have, it's something that you can diagnose clinically.
So I had mentioned earlier that it's between, for both adults and children. At what age can it be diagnosed in a child?
So and
how late can it happen in an adult?
Okay. So for children, most times anything age 5, 6 and above, let's say 6 and above, you can make a diagnosis because children, it's expected that the airway is not properly developed. So there could be what they have most of those times is called bronchiolitis, not asthma, So you now make that diagnosis of asthma from age 5, 6 and above of asthma. Then for, what's it called? For adults, in fact, even I've seen patients that even at age 50, that's when they are presenting
for the first
time with what looks like asthma. So it's not something that it must be at a particular age, 6 or 10 or 12 or 15. Even elderly patients can present for the first time with asthma, and they've not been having such kind of symptoms in the past. Just like I said, it could be a genetic thing, and it's not manifesting in the early stage of life, and it's not manifesting when the person is growing older.
So genetic, it may not be the direct parent of that person, right?
Exactly.
It could be a grandfather.
It could be an uncle.
It could be an uncle.
Oh, yes.
So if it has happened somewhere along the line in the family, there's a possibility of it happening to any member of that family.
Exactly.
Okay, now let's talk about the prevalence. WHO said in 2023 over 300 million people were affected, but when it comes to statistics in our country, we're still trying to get it right.
Yes.
But how often do you see patients coming in for this condition?
Just like we have mentioned, it's actually underdiagnosed in most times. So the figure might even be more than that, especially in the low and middle income countries. It's daily basis, there's always a patient with such symptoms. For instance, now, we are more in an urban area where we have so many things going on that could predispose us to this condition. Fumes, smoke, dusts, irritants, damp walls and stuff like that. So those symptoms is frequent in some of the patients that are not managing it properly. Some people, due to wrong management, they don't have proper control. And because of that, they are exposed to having the symptoms frequently. And they present to the hospitals regularly. So most times, both in children, both in adults, you see regular presentation in the hospitals. So I would say that figure might even be more than that because of poor diagnosis and poor control that we have.
Okay, so we'll still talk about the management, which is very key. But you see that some people, they have asthma, maybe once in a while.
Okay.
Some, as you mentioned, it's almost, regularly that these things would happen. What makes that difference?
Okay, so now, exposure to symptoms. Prevention, let's start from there. Prevention is the key word in management. And that's why we educate our patients that these are the things that would make you to have frequent symptoms. Frequent symptoms comes from exposure to those things that trigger
the crisis.
As the crisis, that's the word, the attacks. So once you know that these are the things that may trigger an attack in an individual, it's expected that the person should avoid. So once you avoid, regular presentation to the clinics or to the hospital is reduced. Regular use of the inhaler during an acute condition is reduced. Quality of life is improved. You understand? So most times that's the problem. It's that exposure to trigger factors that actually leads the person to coming regularly. That differentiates the person that doesn't have the attack regularly from the person that have the attack on frequent basis.
But there are some people, they try as much as possible to stay away from these triggers, yet they still have, these attacks regularly.
So now, it now boils down to management. How do you manage your attacks? Apart from exposure to triggers, there are inhalers that prevent such attacks. Is the person using his inhaler medication regularly? These days now, with this, fine, they are expensive, fine, they are not, some of them are not in the country because some of the producers of those inhalers, they've left the country and stuff like that. But at least we still have them, So how often, because it's not just only exposure, are you taking your inhalers regularly? Those inhalers, what they do, they are corticosteroids. What they do, I said at the beginning that this thing is as a result of chronic inflammation. That inflammation is when they are exposed to those triggers. Those triggers now lead, they how do I put it now? They trigger that inflammatory process within the airway. So you have inflammation, you now have swelling, you have edema, you have all those things coming up to narrow the airway. So what the inhaler do, they are called inhaled corticosteroids. They reduce that inflammation. So if you are taking that inhaler on regular basis, it prevents as prescribed. It prevents the occurrence. It prevents the inflammation from happening. So if that happens, then the person it does not come down with the condition. So the inhaler use is very, very important. That's one. And also regular monitoring. There are what we call peak flow meters that could also use at home, that one can use at home to assess how good the control is or not. Just blow into that and there's a measurement.
That will show.
Yeah, it's trying to show whether you're in good control, you're in moderate control, or you're in poor control. You understand? So one too can assess, okay, am I taking my inhaler properly? Am I taking it the right way or not? Am I using the correct inhaler? So all those things will also determine how often this person comes down with symptoms.
With the attacks.
Exactly.
Okay, we'll just take a very quick break, and when we come back, Dr. Agbola will still be here, and we can also take your contributions. Just stay with us on the program.
You've seen the news, you've heard their stories.
As I see the world have gone 2 months, I told my family to just go out.
The climate crisis is here and getting much closer.
Rice, they're just dry.
So let's look at the solutions and the way forward at these times on Earth Fire.
Welcome back. Dr. Agbola, now let's talk about the management of asthma, because where it is present, it is very important, to ensure proper management, as you've alluded to earlier. So Let's talk about that.
So in managing asthma, we need a plan, an action plan. And that plan includes, first of all, educating the person that has asthma on what to expect, one, on what to move away from, trigger factors that could cause these attacks and that could make the attacks to be prolonged. Then what to do when there's an attack. Then how to prevent the attack. We have mentioned the trigger factors initially: dust, cold weather, smoke, irritants, insecticides, fumes from frying pans and stuff like that, and very cold extremes of weather, obesity. These are things of viral infections, like even common cold, could affect the airway and block the airway. The person could have such symptoms. That's one. So in acute conditions, we have said there are inhalers the person can use. These days now, people are moving from what we call short acting beta bronchodilators, understand, and moving to longer acting bronchodilators, formoterols, and this has been found to actually help in reducing, in having effects both in acute and in chronic conditions. Then we have combined inhalers, both bronchodilators and the inhaled corticosteroids in one inhaler. That helps to prevent attack on regular basis.
And of course, this will be prescribed by the doctor,
depending
on the severity of the case.
Depending on severity of the case, and also to prevent future attacks. I had a patient one time, and she was coming down regularly with the attacks. So it was affecting her job. So, but with the use of these combined what's it called, inhaled corticosteroids and bronchodilator, long-acting bronchodilators, she had reduced
better quality of life,
reduced symptoms, exposure to symptoms and stuff like that. So it helped a lot. So now the way forward is use of this form of inhalers to prevent.
For parents who, of course, have children who are dealing with asthma, what would you advise them to do in terms of monitoring and ensuring that they know what becomes different?
Good. So the first thing is to still prevention, to make sure that they are not exposed to things that will cause that. That's one. Two, to know the symptoms to expect. When you know the symptoms to expect, cough, difficulty breathing, wheezing sounds, they would be able to act fast. Now, there are inhalers, there are nebulizers that you can use at home. Short-acting bronchodilators that we use through nebulizers. Parents can be taught on how to use that, yes, to prevent a worsening of condition. So in acute situations, they can use that at home. If after like 2 uses, it doesn't relieve let them come to the
They have
hospital.
to go to the hospital. I was
Come to
going
the
to ask
hospital.
for that because, at what point do you know when exactly to rush down to the
Exactly.
hospital?
Come to the hospital. There's no need to waste time. Let's prevent unnecessary deaths from such conditions.
And I've heard that people say you can outgrow asthma.
It's how you manage it. It might not really be able to outgrow asthma. I mean, if somebody at 50 or 60 years is coming for the first time with asthma condition, so it might not really be able to outgrow it. It depends on your management. I think people now get used to that management that they avoid. And in doing so, maybe that would tend to outgrow the asthma. Not really that they outgrow. The genetic condition is still there. The exposure to environmental issues, they are still there. The obesity, if you don't manage it, is still there. So it depends on how you manage
it.
That will determine.
And again, it is important to manage asthma.
It's important to manage asthma.
And also to try as much as possible to stay away from the triggers.
Exactly.
Thank you so much, Dr. Olurotimi Agbola is a consultant family physician with the Lagos State University Teaching Hospital.
Thank you.
Thank you indeed for your time. And I guess you've heard about the Hantavirus, a rare respiratory disease. The World Health Organization, while monitoring the situation, said although it's a serious disease, the WHO assesses the public health risk as low because hantavirus typically does not spread easily between humans, unlike COVID-19. Let's now share with you the latest stories from the local and international health scenes.
The Sokoto state government has confirmed the death of 33 children following a fresh outbreak of cerebrospinal meningitis in parts of the state as health authorities battle a growing number of infections. Confirming the outbreak, the State Commissioner for Health, Dr. Farouk Abubakar, said no fewer than 256 suspected cases have been recorded across 8 local government areas since the outbreak resurfaced about a month ago. Dr. Abubakar said most of the deaths occurred in communities before victims could be taken to health facilities, blaming delayed treatment and widespread misconceptions that the illness is spiritual rather than a serious medical emergency. Meningitis is the inflammation of the membrane surrounding the brain and spinal cord, most commonly caused by viral or bacterial infections. Symptoms of the infection often include sudden fever, severe headache, neck stiffness, vomiting, sensitivity to light, confusion, and convulsions. Health experts warn that without urgent treatment, the disease can lead to death within hours or cause permanent complications such as hearing loss, brain damage, or paralysis. Officials from the Federal Ministry of Health and the National Primary Healthcare Development Agency on the streets of Abuja, the Federal Capital Territory, they're out to sensitize members of the public on the importance of vaccines as a cost-effective tool for protecting public health as part of activities marking the 2026 African Vaccination Week. Leading the campaign, the Executive Director of the National Primary Healthcare Development Agency, Dr. Mui Aino, said the federal government is committed to ensuring that no child dies from vaccine-preventable diseases. Dr. Aino adds that the agencies will continue to engage Nigerians through different platforms, including Vaccination Week activities, to ensure that every child between the ages of 0 to 5 receives the appropriate vaccines. He also states that the government has introduced more life-saving interventions, including the rollout of the human papillomavirus vaccine.
We continue to work with all Nigerians to make sure that children everywhere are reached. No child's life should be allowed to be taken by vaccine-preventable diseases. The human papillomavirus vaccine has been rolled out, and through that, we have over 16 million teenage girls in Nigeria today that are protected for life against the human papillomavirus and cervical cancer. The measles rubella vaccine campaign, we were able to reach 102 million over that children 0 to 14 years old in Nigeria. And that is an incredible number. And we can all see that already in the impact in reduction in outbreaks, in reduction in debilitating disease.
Finally, on the news segment, the World Health Organization says 5 cases of Hantavirus have been confirmed in connection with an outbreak on a cruise ship, warning that more infections may emerge due to the virus's 6-week incubation period. The Director General of the WHO, Tedros Ghebreyesus, says 8 cases have been reported so far, 5 are confirmed, while 3 remain suspected. However, an epidemiologist with the World Health Organization, Maria Van Kerkhove, says the outbreak is not the start of a pandemic like the one the world experienced 6 years ago. She explains that the virus does not spread in the same way as coronavirus, but rather through close, intimate contact. In the meantime, 3 people have died, either on board or after traveling on the MV Honduras, which set sail from Argentina a month ago and is expected to dock in the Canary Islands at the weekend. Contact tracing is underway in several countries for passengers who left the ship before the outbreak was detected, including the United Kingdom, Switzerland, and the Netherlands. Hantavirus is a rare respiratory disease that is usually spread from infected rodents and can cause respiratory and cardiac distress. The version detected aboard the stricken Honduras ship was a rare strain known as the Andes virus, which can be transmitted between humans. There are no vaccines and no known cure, meaning that treatments consist solely on attempting to relieve the symptom.
And that's how we draw the curtains on the program. Thank you for being with us on Health Matters. Looking forward to your company next week. I am Yomi Otaigwe. Bye for now.